I am Kyu-Suk Kim, Department of Integrative Medicine Professor, who is conducting the joint research with Professor Kyu-Bom Kim of the Department of Integrative Medicine. Our research team is conducting the research to overcome the limitations of existing systems in relation to dual energy X-ray absorption technique and Dexa systems, and further successfully perform the porous materials separation. In this presentation, I will present about the patents and research technologies that have been done. First of all, when the radiation is emitted from a diagnostic X-ray source, as we know, attenuation occurs as it transmits the inside of a material, and the remaining information after attenuation is measured by the detector to get the image of the information. And each material has its own attenuation rate to various energy, and it is called an attenuation coefficient. At this time, the X-rays released from the diagnostic radiation are unfortunately X-rays with the polychromic spectrum, not just mono or one energy, so when we get images from the diagnostic radiation, the reflected images with attenuation coefficient ratio of various materials are gotten. If we can ideally get the image of a mono radiation, then we can classify the material by reflection of the appropriate ratio for the difference in the linear attenuation coefficient of each material. One of the representative contents of this material separation applied method is the bone density measurement. As you know, osteoporosis has a lower bone density than normal one, so it is high feasibility that fractures will occur, such as the wrist, spine, and hip joints. And since there are no signs of disease in advance, it is very important to check bone density frequently. There are 3 typical ways to measure the bone density: Dexa, bone components extraction by the method of low energy and high energy radiation, to quantitative methods of bone density measurement Dexa, and quantitative ultrasound method to measure the bone density by the quantities of the ultrasound, QCT method by quantitative method through CT. The remarkable points are that the Dexa method has advantages in terms of accuracy, cost, and dose compared to the other 2 methods, and the Dexa method is currently used as the most representative method of bone density measurement. The aspect of the marketability, as shown in the figure on the right, the current bone density measuring device market is expected to grow to about 3.3% annually from 2017 to 2020, and is expected to grow to a market worth $50 billion by 2023 year. This is now correlated with the trend of the elderly ratio worldwide, and if you look at the trend of the elderly ratio over 65 years age worldwide, you can see that the ratio continues to increase, and it can be seen that there is a sharp increase as of 2010 in Korea. The table here shows that the proportion of osteoporosis, osteopenia, and normal among men and women over 50 years old increases overall twice as many as age increases, and about 68.5% of women over 70 years old is found as osteoporosis patients. Based on this, the bone density measuring device market is expected to grow continuously in the future. To introduce the simple concept of Dexa method, as shown in the figure on the left, the Dexa system has the bed where the patient lies, and the detector that measures X-ray source radiation. Detector the measure as up and down way, as the patient moves in the direction of the arrow and performs a linear scan. To do Dexa requires acquiring low energy and high energy images, but recently, by placing a samarium filter of the X source, the radiation is separated into low energy and high energy areas, and the system to get the images of low energy and high energy areas are generally releases to market by getting in a photon counting detector at once. In light of this, the low energy and the high energy image each show an image reflecting the attenuation coefficient of each material according to each energy area. And if the ratio of the difference between the relative materials is properly considered with the appropriate rise value, the separated material image can be obtained. Especially in the case of bone density, as mentioned previously in the Dexa system, We can measure the double energy and take the bone's image from L1 to L4 to measure the bone density according to the method suggested by the World Health Organization. And T-score directly determine how to be the fracture possibility, the risk based on the bone density of healthy people, and Z-score to check the second cause based on the average bone density of same ages. Thus, it can be assessed the osteopenia and osteoporosis. These existing Dexa systems have two main limitations. First of all, the limitations of the detector. In the case of currently being released many detectors, semiconductor-type detectors that directly make the radiation such as CDT and CZT into electrical signals are used. So they do not use a scintillator, high stopping power, high energy resolution, and special resolution, but there are many channel numbers required to be read out after these radiation signals. But there are weaknesses for sensitivities of bias voltage. Especially, the manufacturing costs are very high, and the high noise input ratio of signal to noise. Our research team tried to overcome the limitations of the previous detector based on a detector that combines a tricolor body, called LYSO, and a SIPM sensor, which is an indirect detector that converts radiation into light, firstly, and into electrical signals. And the biggest advantage of the detection method is that it has a very low manufacturing cost and remarkably low noise input ratio. To verify actually the method of our proposal, we have done the following prototype setup and will tell you the results of the performance evaluation. On the system setup, the X-ray position to be applied the samarium filter and place the detector we propose as shown on the left. And now front-end electronics and DAQ are installed to process the signals from the detector. The actual used phantom was an aluminum step phantom with each thickness, and a radiography under a certain water phantom to conduct a performance evaluation. From the results, we could confirm that the area density was measured for each aluminum step phantom, and the existing CZT-based detector and the proposed detector occurred in a within about 3% error compared to the ideal case, and the tendency was also very similar. Additionally, when measuring the contrast to noise ratio with the water phantom as the background, we could confirm that the detection effect of the proposed detector was almost similar, or better, for each aluminum thickness compared to the existing detector. Through this, we can check that the detector we propose is sufficiently applicable to the Dexa system. Second, it was hard to separate the multiple substances due to the limitation of the existing Dexa system. Most of the existing Dexa systems have divided two substances, but this patent suggested that separation over three materials can sufficiently separate multiple substances from the Dexa system, and we confirmed the possibility. First, if you look at the mimetic diagram of the method we propose, firstly, it is obtained the low-energy radiography and high-energy radiography from the Dexa system in advance. We get the information value of the material we want to separate from the database, which is containing thickness, intensity, and constant. That corresponds to the second of the flow chart. Through this process, the weight maps are extracted through a deep learning network trained in advance to separate the bones from the low-energy and high-energy images obtained from the Dexa system. And based on this, the low-energy and high-energy gets the projections, which the removed bones are obtained. After that, at stage 5, data on the fat and muscle to be separated from the thickness, strength constant database as shown in stage 2 are obtained, and based on that, the material is finally separated. To tell you more details about this mimetic diagram, I will tell you about the core contents of stage 1 and 3. First of all, I briefly presented the Dexa concept on stage 1 part, and I said previously those materials can be separated by giving appropriate weights to low energy and high energy radiation images. But they are actually separated as the equation in the middle left. The circled ones here refer to the actual constant value. And if we know the constant value already, we know the actual low-energy radiation image and the high-energy radiation image PLPH, so we refer to the variables of the actual TDTS or parameter of the material classified image, which can be separated as like this. If so, how can we know the low circular constant value in advance? We manufacture the step phantom as middle above with materials that are almost similar to and almost equivalent to the material we actually want to separate. If you arrange and irradiate the radiation as follows, you will get the radiation images as shown in the lower middle. At this time, we can know the actual material thickness, TD and TS, so we can make a lot of equation to take the intensity values of each low energy image and high energy image, PL/pH, and calculate the simultaneous equations to obtain each constant value in advance. So, to do this method, the pre-design for the actual step phantom is very important, and as I told you previously, the formula for the material separation refers to a very ideal case for the radiographic image. So additional connection techniques are needed to scattering and noise from the actual radiographic image occurrences. Next, Dexa, which I mentioned in Mimetic Diagram 3, said that training was performed through pre-deep learning to remove bones from low energy and high energy images. And I'll present you how the dataset was organized. First, based on well-refined CT data, low energy and high energy images are acquired through virtual radiation imaging work. And as like the previous method, we take the thickness strength constant data and extract the information about bone material as it is written in input. At the same time, if this material is removed from the same well-refined CT, and then virtual radiographic imaging is performed in the same way as below. The removed image, which is low energy and high energy bone, as below, and through the subtraction of pre-acquired low energy and high energy radiation images, each energy information of bone will be obtained. It is called weight maps the difference of input data, and it can perform the deep learning by the input and label. Actually, when we get the low energy and high energy images from Dexa systems, we also get the videos corresponding to input and extract the weight maps based on them and get boneless projects for low energy and high energy images as we learn the components for each energy. In this case, well-refined CT data, DRR techniques, and deep learning techniques are required. In fact, to show you the results of our simple simulation, in the above case, fat and muscle were imaged using new medical CT data, and the following is the imaged method by the proposed method. Actually, when we compare CNRs for each area, the reference was 1% to 7% compared to the estimated results, and we expect that we can overcome this part more through a little algorithm revision. To sum up, our research team has the technology to lower the cost of the existing Dexa system and to perform more porous material separation technology, and is further research is ongoing in the future. Currently, we have done the simulations and experiments, and we plan to go further to clinical studies. And if we have a more objective by applying to systems, such as digital tomosynthesis, for more accurate materials separation, we aim to detect the multiple myeloma currently being examined by dual energy CT. Thank you for your attention.